New COVID-19 cases in New Mexico are once again rising, according to the most recent data from the state health department. In a press conference Wednesday, Governor Michelle Lujan Grisham joined health leaders to talk about the situation. And during that update, health leaders pointed to waning immunity among vaccinated New Mexicans as one of the issues. That's pushed the state to join only a few others at this point, making the boosters available to all adults. The governor says they've become vital to controlling the virus as the CDC and FDA weighs nationwide approval. Now, will it help, or is this all about our unvaccinated folks? So let me put that to Dee Dee. There's a lot of science out there that's saying the unvaccinated folks, this thing is mutating, things are happening, they're unwittingly sort of spreading this. What's the next step here when it comes to unvaccinated folks particularly?
Well, I think continued mask mandates, especially for unvaccinated people, are important. But of course, how do you know who's unvaccinated and who's vaccinated? But I think the statistics are now that 23% of those people who are hospitalized have been fully vaccinated.
Right.
So that is that's the problem now, and that's why boosters have been opened up to everyone. And I think that's very important. I got my booster a couple of weeks ago, and I think they're pretty widely available now. And I encourage everyone to get them. I continue to be alarmed by the rate of COVID spread amongst children. And this is now accounting for 25% of new COVID cases. So I think that in addition to getting boosters, children have to be vaccinated. And I think the statistics there are that there's only 6% of children from 5 to 11 years old have been vaccinated. So we have work to do in that population, as well as with getting boosters to everyone who wants them anyway.
Well, the health department's reporting 73% of state residents 18 and over are fully vaccinated, as you mentioned. 15% already have received a booster. 55% of kids 12 to 17 have completed the vaccine series. And of course, the 5 to 11 cohort just kind of getting going, and that's going to be interesting. David, according to recent reporting by the New York Times, New Mexico now ranks second in the nation for the number of hospitalizations per capita in the last 2 weeks and eighth in the number of COVID-19 cases. Yet we have one of the higher vaccination rates, also per capita. Given that, was the governor smart to extend the indoor mask mandate for another month?
Listen, I mean, anything that can help, and as Dee Dee pointed out, masks, and there's just a new study out today from the CDC showing that masks can be very effective. Yes, I think she should. I mean, the courts have been very clear. Unfortunately, with President Biden, you cannot do a mandate. They sort of moved the mandate away after the holidays. Businesses are saying they don't want a mandate. I think the problem is we need to get people to understand, all of the things that you're hearing. I mean, I heard a story, and I really just could not really figure out what to do with this story, of someone who had the vaccine. Their son immediately came over with a magnet to check to make sure that nothing had been inserted during that vaccination, the Bill Gates microchip or whatever.
Wow.
And I keep thinking to myself, like a number of people that have not been vaccinated have said to me, I'm going to study the vaccination. And I keep thinking to myself, and I have not said to them, although maybe I should, tell me again where your PhD in biochemistry is from and exactly what are you going to study? We need to encourage people to get the vaccine. And we need to stop acting like a bunch of peasants that are hoping to turn, dust into gold. It's not going to happen. I mean, we are the country, of course, that went into complete, whatever you want to call it, chaos with War of the Worlds in 1939. But hopefully we've progressed. And we just need to say to people, get the vaccine. The science is safe. I don't believe that they're going to allow something to be injected into you that's going to kill you or cause mutation or whatever fantasy these people have been working out. And they keep reinforcing it. Oh my God, we don't know what the long-term effects are. Well, we do know the long-term effects of COVID. You're dead, so you don't want to do that.
True. Good point there. Speaking of that, Tom, hospitals continue to suffer. At one point this week, there were only 8 ICU beds in the entire state. And UNM and Press have both moved to crisis standards of care to make tough decisions, as you know how to allocate resources. Have we hit a breaking point on this?
Oh, absolutely. When you look at the type of stress that is in the healthcare system right now, there's the state is taking over and directing who goes to which hospital and who gets into a bed. So if you're injured in New Mexico, you have some real challenges of getting a hospital bed. I think to harken back to one of the items that Dee Dee brought up earlier is that, when you look at the number of people who are vaccinated, fully vaccinated in New Mexico, and you look at those who are hospitalized, that is a small percentage. But when you look at those who are in ICU or even on ventilators, at least in one hospital numbers that I saw, it's zero. So we know that the vaccine works. We know that those who have been fully vaccinated are not necessarily going to be seeing the major effects like we're seeing with those who are not vaccinated. I think what we also need, though, is a reset on information. To Dave's point, there's obviously a lot of misinformation still that's out there, and now adding into the mix is, how long did the antibodies last?
That's right.
And so, there is just a lot of, continued miscommunication. And I'm not sure where, that needs to, as far as who owns that particular message, is that at the federal level with, Dr. Anthony Fauci, and then everything kind of trickles down. I wish it was that simple, but, I think we all just need to hit that reset button on information and just look at the facts again, because, the continued separated dialogue is not helping New Mexico residents. It's actually hurting.
Well said. There's a difference between inoculation and vaccination. That's always the confusing part I hear from a lot of folks. Dee Dee, I've been dying to ask you this question. At the same time all this has happened, the state Supreme Court settled a legal fight over how New Mexico is spending federal COVID relief funds. The court, as you know, ruled in favor of 4 Democratic lawmakers challenging the governor's unilateral spending decisions. Now the legislature has to get that spending figured out during an already jam-packed special session for redistricting. By dragging out even longer, could this end up backfiring from a political perspective for those lawmakers?
I don't know. I think that's a good question. But I want to say one thing about this ruling, first of all.
Please.
And that is, we need to separate 2 issues in terms of the governor's power and what the Supreme Court has said about it. The Supreme Court has affirmed the legislature's authority to appropriate federal funds. It has also affirmed the governor's authority to make public health decisions when it comes to COVID. So it is not across the board repudiation of the governor's authority. It is simply affirming the legislative authority to direct over $1 billion in federal funds from the for COVID relief. It's not even clear, though, whether this ruling applies to other federal funds other than the COVID funds. And I thought it was really interesting that, okay, so yes, and I'm a fan of the legislature, of course. I'm a former senator. But the governor will have the ability, once the legislature appropriates the funds, to veto them. So, we're kind of back to square one there.
I hadn't considered that. That's interesting. You're right. Oh, wow. Let's see how that plays out. All right, well, we're all keeping our eye on those COVID numbers as we head into the holiday season. Thank you all for this insightful discussion. Still to come on the line, reaction to new shakeups in Governor Michelle Lujan Grisham's administration.